So I'll be talking about smartphone GONIO imaging. So as we all know, glaucoma is the second most common cause of blindness and leading cause of irreversible blindness, with prevalence of around 11.9 million, in equal proportion of primary open angle and primary angle closure glaucoma. So as we all know that population studies in India have proposed periodic screening of high risk population for diagnosis of the disease at an early stage, and imaging of the anterior chamber angle with gonioscopy forms an integral part of this glaucoma screening, diagnosis and management. But as we all know that it is very much limited to the slit lamp, because without the slit lamp gonio imaging is not possible. And recently there are few, actually only one article which showed the use of smartphone for gonio imaging. So over here I would like to describe what I have made. This is anti-segment photography with intraocular lens, that's this ASP. So this is basically what I was using to image the anti-segment without a slit lamp. So we don't really need a slit lamp to image the anti-segment, and this is how I have done it. So we use a chart paper of 10 centimeter to 1.5 centimeter. Once we have cut it with a scalpel, we fold it and mark the area where we want to keep the IOL. And inside this, we add a double-sided tape and we punch with a paper puncher, we punch one hole. And for the gonio imaging, we use a 6, 8 or a 10 diopter lens. So what I've used here is either a 6, 8 or a 10 diopter lens, and with the flashlight on we'll have to take the image. So we take a video, and then from the video we take the image, and this can be done with any phone, preferably a phone which has the side camera, the camera which is in the corner, because the thing is, the problem is in gonio imaging your nose comes and hits, so that is a big problem. So we did this in our in Arvind Hospital, Coimbatore, with 120 patient over a month, and so we used. It was a very routine examination, the way we do it in the slit lamp, except that we don't use the slit lamp. That's the only thing. So we used. So I'll show you the images. So this is how we use. We did it by making the patient sit on the slit lamp for stability, or if there is no slit lamp, we we did this with patient just sitting just like that, even with lying down, even with the retinoscopy slit also, we use a slit to replicate the way we get images in the normal slit. So these were the images that we got using the ASPI GONIO. So you can see how clearly you can actually see these structures, and this was the one which we got using the retinoscopy slit and the ASPI GONIO together. But the problem over here is we need another person to actually focus the slit to the angle. And over here you can see this is the principle, basically more or less the same thing, just that we are using the ASPI GONIO here. So here you can see this distance reduces as we increase the IOL power. So this is 6 diameter, then this is the 8 diopter, and this is a 10 diopter. So as you can see, it is reducing. So anything more than 10, you will actually hit this flange of the gonio lens. And these are the corresponding images that we have got. So you can see as we increase the IOL diopter, the magnification also increases. And the last row, okay, you can see these are all the images taken from different lenses. So single lens, 3 lens and 4 mirror, mirrors. So single mirror, 3 mirror and 4 mirror. And we actually found out the 8 diopter IOL with a single mirror could actually give very good images. So that is what, and this is a comparative image. This is a slit lamp image, and this is the image which we have taken from the smartphone, is the ASPI GONIO. These are also images of the slit lamp with the ASPI GONIO. These are all the same. So the one on the right is actually the slit lamp image. So we graded the image, and we found it to be very comparable to the slit images. So you can see 92 and 78. So this is according to this grading. So we have noise, sharpness, contrast, diagnostic confidence, artifact, and blotchy appearance. So 1 being the minimum and 5 being the highest. So with this, we graded all these images, which was randomly put and given to grade, and we could see actually it was almost comparable to that of the set lamp. Also, we graded the angle according to Schaffer's grading, and actually we ended up diagnosing around 4 patients as angle open because of the pupil constriction because of the smartphone light. So, but the main thing over here is we can use this as a screening tool at places where slit lamp is not available, where we are not able to reach. So there is a need of a compact health monitoring system, especially in small clinical setups such as peripheral health centers. And this was the first of its kind of study using this ASPI GONIO. Thank you.
How did you come up with this? What made you come up with this idea?
Actually, I my first innovation was the red cam, the trash to treasure red cam, which I did using a hand sanitizer bottle, which I converted
I
into a
saw
red
that
cam.
in the TOT competition, one of your residents
Yes.
was presenting.
Ah, yes, yes. So then later on, actually, my mom said, "Why are you presenting the same thing everywhere?" I was like, it's difficult to do even one innovation. But then I actually took up it as a challenge, and I'm actually good with photography is my passion. So I had a little bit of the knowledge of how lens works. So I thought, why not use this IOL? It's actually like a magnifying lens and a macro lens. So I used IOL, which was actually expired IOLs, which we get to take the anti-segment images.
Hmm.
So eventually, I thought if I could take anti-segment, I could actually do anything which the slit lamp is used for to magnify. So just thought maybe we should try doing GONIO too. But then slowly, when we see, it was very difficult because we used to use 15, 20, 25 for anti-segment. So those are all the higher powers. So when I used to go, it is to always go hit the flange. And slowly I thought, okay, we should reduce the IOL power. So we started reducing to almost, we started from 5, 6, 7, 8, 9, 10, 11 till 15. We used everything. We trial and error. So a lot of times we did. And eventually we found out that this one was the best, image which we got. The only issue over here we are trying to solve is about the light, because as you can see, those 4 cases we could actually miss because it could be wrongly graded. But at least we could actually go for screening, because places where there's nothing else we can use this. And those 4 cases which are in the border, we can actually send them to the base hospital to get it fully evaluated.
But being Arvind, you have to be.
I'm using the PMMA rigid lenses, which I use with 6 diopters, 8 diopters. Sorry, 8 diopters. I will.
Being Arvind, you have to be careful because if you go tell a patient that everything is all right,
Uh,
so we have to be very careful and with not with what you said, the 4 cases, because those 4 cases you
yes.
got because you did both examinations.
Yeah.
So before screening and before promising that this will screen and pick up all the angle closures,
Yeah.
we have to be very
Very
careful.
careful.
Yeah.
But at least we could actually diagnose these, because otherwise we wouldn't have checked the angles of these patients. But now we have a alternative, and we could actually get these 4 patients to get it properly checked. Oh, those ones in the borderline, like who, if we feel that Schaffers 1, 2.
Excellent.
Yeah, single mirrors, and this one works really good. Yeah, maybe sometimes.
In fact, for Gonio photos, we have also started using a two mirror single mirror.
Single mirror. And I don't know, I've used, and other people who are using, who I used to send to, take the comparative images, they have said the smartphone Gonio imaging was much easier than the slit lamp. And now one more hack is that, the if the Gonio lens and the mirror is here, you go with the phone from here. Okay, you don't go from here or here or here, you go where the mirror is. And the video, one more another hack is that when you go from this side, before the pupil constricts, you would actually record the actual angle too. Not every time, because sometimes it takes time to focus, that time you will miss. But when it's already focused, when you go inside, you can actually see the angles opening, and it is video recorded, and you can actually go back and see what the actual grading was.
It will be very interesting to look at those videos.
The light source is extremely powerful, so that has
Yeah.
to be you have to be
Yeah,
very careful.
we
It's
can
very
actually
amazing.
reduce it using a micro pore or
Yes,
something like that.
probably something.
Yes.
So is the next thought about looking at the fundus? Are you already thinking, because now you are gradually going in?
Yeah,
So
but
maybe something.
yeah, eventually I think there's
It's amazing.
already a instrument called peak retina, which
Yeah.
is almost like this.
Yes. That
Yes.
is very similar.
But the thing is, actually, this whole method is done in such a manner that even you can go home and make your own SP Gonio and start taking images. You can compare it yourself, or maybe if you have your kids, you can just tell them, just make this, and they'll. It's more of a craft work.
And for the
Anybody can do it.
yes, anterior segment photographs.
Yes.
It's a 20 diopter. you're saying?
15 to 25.
to 25.
15, you'll get the whole of the cornea. The whole cornea, the whole field, you'll get the whole cornea. If you go to 2025, you'll be more focused to a particular point in the cornea. If you have a particular foreign body at one place, if you put 25, you will get it so beautiful image.